Yeah, I'm raising this issue because it's having a detrimental effect on everyday lives of people, whether that's elderly people or disabled people. So I'm contacted on a regular basis by family members of older people who have been approved hours and they're not being filled, of disabled people themselves or carers on their behalf, and the same thing is happening. So this is where a home care package has been put in place, the person has been assessed, the hours required are approved, but then they're not filled, and this is happening on a regular basis. So, for example, I was talking to one young man last week, Finn is his name, he's 22 years old, almost 23. He has a condition called Duchenne muscular dystrophy, and his mother is a sole carer, she's a single parent. He has been approved of a package of 7 days a week, twice a day. 2 carers would come in order to get him up in the morning, get him changed and up for the day, and then at night to put him back to bed. Invariably, carers either do not turn up at all, or only one will turn up when 2 is required, because it requires 2 to turn him. So it means that she has to go and ask somebody, a neighbour or a friend, to come in. Now, those neighbours and friends do absolutely not mind, but they may not always be available. And she shouldn't have to rely on that, sort of help on an ongoing basis. Now, she states that some of the carers are directly employed by the HSE, and they come in during the week, and they are generally very reliable. They come in, they're trained, they know what they're doing, they stay the length of time that they're supposed to. But the HSE relies on an agency to provide the care for quite an amount of the time, and she said no exaggeration, about 20 different people through her door. They're not trained. They are not even told or informed of what Finn's care needs are. One carer came in and tried to move him from the back of the neck, not knowing that he has a rod in his spine. They actually hurt him, and he was 2 weeks in considerable pain. So, she said, like, the agency is not reputable. She's not saying that about all agencies, but this one isn't, and the HSE, I think, need to review the agencies that they're employing to provide the care. Preferably, I would like to see them directly employing carers, so that this situation doesn't arise. Another lady, Lindsay, she's only 34, and she has what's called locked-in syndrome. She can only move her eyes following a stroke. She has an intensive care package where there's 3 visits a day from carers. 3 carers are required at a time to come into her 7 days a week. Again, her parents are her carers. Invariably, again, only 1 carer turns up or 2 carers turns up, and it's not sufficient. So she's not getting the care she needs. When I write to the HSE about this, and other cases as well, I'm given an outline of the care package approved, but told that the carers are not just there. That's not good enough. I think people with the most need to prioritise, first of all, that they get the care that they require. We can't have people left for a whole weekend. Like Finn's mother, for example, was rang last Friday at 4 o'clock and told, we've no carers for the weekend. So, and then when she tried to ring back, couldn't get through to anyone. Sometimes their lines are only open for maybe 2 hours a day, and nobody might even answer or return calls. People are just being left high and dry, and it's a huge issue. It's preventing people going into nursing home or residential care by being kept in their own home. It's their preference. It also saves the state money. I know that the care packages can be expensive, but they wouldn't be as expensive if this person had to receive round-the-clock care in a nursing home. So they should be facilitated in staying in their home and given the proper care by trained professionals with empathy and understanding, and who act in a professional manner, and that's not happening on an ongoing basis, and families are at their wits' end. So I'll come back to more in the second part. Thank you.
Minister. Thanks for sharing those stories, and I think it was important that you did share them on the record of the Dáil, because it is important that those types of situations should not be allowed to continue. There is, in fact, and I completely agree with you in terms of, and we all have stories like that, there is actually more home care going on. And in Cavan, just to give the exact position in Cavan at the moment, there's 724 people in Cavan availing of home support services. The waiting list is 146 at the moment, but of that 146, there are 26 on the list who have no care, like they're waiting for their package to start. The remaining 120 people have care but are seeking more care, or maybe there are staff maybe not available. So in Cavan and Monaghan, there's a joint target set, and the target is for 2024. The target was set for 608,460 hours of care Now, this year, we expect that the total number of hours will be 662,000 hours. So this will be 9% more than the target, and would actually mean, notwithstanding what you've said, and I absolutely accepting what you're saying in terms of the deficits is there, but actually it means 50,000 more hours this year than last year. Now, the HSE tell us that priority is given to those in the community with acute needs, and you've obviously listed ones for that is, hasn't worked out for, and people waiting in hospitals who want to return home with supports. While there is significant level of service provision across the area, demand continues to grow. The HSE recently reported that Cavan Monaghan had a rolling campaign for the recruitment of healthcare assistants, brackets home support. Since 2021, 88 new healthcare assistants for home support provision were employed across Cavan Monaghan, and there is now a panel in place for healthcare assistants following interviews in April. The HSE has assured the department that they are fully committed to supporting people at home, and we do need to address and committed to addressing gaps in home support in Cavan Monaghan and nationally by supporting the recruitment of home support workers within the sector and continuing to deliver on the recommendations of the Strategic Workforce Advisory Group on home carers and nursing home healthcare assistants.
Yeah, I know like people are living longer, their care needs are going to increase, or we've more people with different neurological conditions, and rather than them going into homes, we prefer to see people, if it's their choice, to stay in their own home and receive the care they need. And it is recognised that they need the care. They've been assessed and they've been approved the hours, but they're not being filled. And there is a crisis in that home care sector. So, I mean, there needs to be a further recruitment campaign and to properly train individuals who are going to take up that work as well. I do think there are people in the community willing to do that work, but paying conditions is an issue. And I mean, there is a difference between the paying conditions of someone who's directly employed by the HSE and somebody who's directly employed by an agency. And we need to fill a gap. I mean, I know sometimes home care providers are driving around rural areas, like Cavan is a majority rural county, and some of the roads and lanes that they have to travel on are very poor, and they get nothing towards travel, and that is an issue as well. But it was also brought to my attention as well that just in September there, home care providers in CHO1, of which Cavan is part of, I know those areas are changing again, but there was an email saying, following a recent pay and numbers letter issued based on directives from the CEO and CFO, and with immediate effect, there would be no increase in hours implemented unless they are reallocated from previously ceased hours. Like what they're saying is that new home care packages can still be approved, but those awaiting, say, additional hours will not be funded for those hours that they are clinically assessed as needed. So, like, there seems to be a pullback here because of money and not providing the absolute essential care that we need, that the people need in the community. And I think that's very serious. Like, I think you can't just have a blunt instrument where you cut off and say, I'm not giving any more money, whether people need it or not. I mean, it has to be looked at and assessed. I mean, and ensure that people are given the hours that they require to live comfortably and safely in their own homes as well. Like the young man Finn I was talking about there, he's now got to the stage where he's nearly afraid to get out of bed, like to let them help him get out of bed because they're not trained, and he's afraid of them falling. And so he's almost confined to bed because of the lack of carers or the lack of trained carers that are coming into him.
I think the details of that should be provided to the Chief Executive of the HSE and the Secretary General of the Department of that particular case of Finn. And the other case that you mentioned as well. I mean, in terms of the number of hours this year, as I said, it's 10% more than we budgeted for, and it's 10% more, approximately 9% more than what was actually provided in 2023. So there's a lot more hours there. I think that there have been some improvements. The new and improved HSE authorisation scheme for home support has been in place since August, for payments to approved private and voluntary providers to deliver home support on behalf of the HSE. And this delivers on commitments for sectoral reform, such as payment for travel time for home support providers, paying carers the national living wage at a minimum, and bringing legacy rates in line with the new revised rates of funding. We do think that this will help, and this is work that has happened under this government, and I know there's a lot more to do, but some of the points that you've raised, we have recognised, we do recognise, and there have been steps taken to address them. And clearly we need to do more. There's no question about that, and we certainly want to do more.